all day since morning, I think we've talked about IOP. But we all know that there are other factors at play: vascular dysregulation, oxidative stress, immune inflammatory response, and mitochondrial impairment. And also, when you look at it from the patient's perspective, so this question, how does lifestyle affect glaucoma? It is among the 25 most common patient questions about the disease. So if you take the Google searches which are done about glaucoma, the patient asks this question more: how does lifestyle affect glaucoma? And if you look at the articles written about glaucoma which have attracted online attention, 60% of the top 5 articles were focused on lifestyle choice topics. So this is something that the patient is very, very interested in. Doctor, what can I do apart from putting the drops to maintain my vision or make my glaucoma better? So there's this, there are many articles which are published, but I would strongly recommend for someone who wants to look at the current status with respect to this, to read this article in the survey. It is a 2022 year published article where it deals about lifestyle and glaucoma. So let's look at each one. I'll only be telling you things about which we have evidence. There are so many so-called supplements and treatments for which there is not much of evidence. So the first thing which is, there is a strong body of evidence which suggests that it is helpful is aerobic exercise. So evidence suggests that there is neuroprotection and also decreased progression of the disease, and also certain extent of IOP lowering in a person who is doing a considerable amount of aerobic exercise consistently. So what does aerobic exercise do? In animal models, it has been shown to shield against oxidative stress in the retina. And it maintains and upregulates a molecule known as brain-derived neurotrophic factor in the retina, and that is supposed to help. And this BDNF level tends to be lower in early glaucoma subjects, and it is higher in advanced glaucoma. So more damage, more the BDNF is something which should be upregulated for protection of the nerve or the retinal nerve fiber layer. So what is the evidence? There are publications which have found that more daily steps, patients who had more daily steps experienced a slower rate of visual field loss. And a multivariable analysis concluded by Mr. Pan and colleagues concluded that 10 minutes of moderate to vigorous physical activity was associated with 85% less odds of progressive vision loss. And Dr. Ramulu and colleagues have found that when stratified by damage, patients in the more severe damage category engaged in 66% less vigorous physical activity. This was based on pedometer data and self-reported data, but of course here it could also be that patients with advanced glaucoma, because of their vision loss, tend to move less. Whether that is cause or effect is something that is up for debate. One study which is contrary to all the other studies which are published is a recently published study in 2023. This is a UK Biobank Eye and Vision Consortium study which has a huge number of people who were studied. And here they found that higher level of physical activities was associated with thicker ganglion cell inner plexiform layer, but then it was not associated with IOP reduction, and there was no association between glaucoma status, that is more severe, less activity, that kind of an association was not demonstrated. Another aspect of exercise is yoga. We definitely know that Shirsasana causes substantial increase in the intraocular pressure because of the hydrostatic pressure in the inverted position. There are 3 case reports which show the worsening of existing glaucoma after practicing this repeatedly. So there are other asanas like wherever the head is placed lower than the heart, like Adho Mukha, Shvanasana. These are all asanas where you hold it for a long period of time. That can have a potential for damage. Using wind instruments and activities with sudden head movements, these have all got the potential for raising the IOP. Pranayama, the Kapalabhati pranayama and Bhastrika pranayama, where you forcibly exhale or inhale, increasing your abdominal pressure. Even these should be avoided. These have been known to cause problem. And like was talked about in the morning, certain people do this therapeutic water drinking. So this is also to be avoided. Swimming goggles are known to produce transient IOP increase, though the association between this and glaucoma damage is not well defined, but this is something that you can tell your patients. And the new kid on the block is mindfulness or meditation. So people have found that the patient's stress and the visual field defect severity are linked. Again, whether this is cause or effect is up for debate. And also that if you give a score called Beck Anxiety Inventory Score, this is a patient-related outcome. This was associated with disc hemorrhage and peak IOP and progressive RNFL thinning. And people who had mental stress were almost 3 times as likely to present with increased intraocular pressure and visual field deficits at the following consultation. This is news for me also, because these were the articles which are showing a relationship between anxiety, stress and IOP and glaucoma. And our own Dr. Dada has demonstrated that mindfulness and meditation is associated with a significant decrease in IOP and also with changes in the trabecular meshwork gene expression. So this is something that we can recommend to our patients. Caffeine, the evidence is not there. It may be associated with mild transient elevations, but there is a potential neuroprotective role, but evidence is by far inconclusive. What about supplements? So nicotinamide was tried. Again, evidence is not very strong. Vitamin B3 is being touted. This is the new kid on the block, and it is there are ongoing clinical trials which is assessing this. Omega-3 fatty acids have also been recommended, and a diet high in green leafy vegetables. This is generally antioxidants. This is for general health, just like that, even in glaucoma. And something known as the MIND diet, that is Mediterranean dash intervention. This is for any form of neurodegenerative diseases. This kind of a MIND diet is recommended. That is just a diet rich in omega-3 fatty acids, less carbohydrates, more of vegetables, fruits, and that kind of a diet. And ginkgo biloba has also been talked about, and there's also some talk about saffron being helpful in patients with glaucoma. Coming to BMI, obesity has been associated with higher IOP, but on the other hand, normal tension glaucoma is higher in patients of lower BMI. So our typical normal tension glaucoma patient is very thin, very slender, has low BMI, and these are in the 40 to 49 year age group. And people with lower BMI develop more paracentral visual field defects. Smoking, no firm evidence. It was not associated in a large study of more than 100,000 participants. On one hand, they say nicotine may have a neuroprotective effect, but on the other hand, the vasospastic properties may cause decreased blood flow and cause damage. What is known is that with respect to alcohol and glaucoma, there is increased incidence of pseudo-exfoliation when the ingestion of alcohol is more. So it might explain the increased incidence of pseudo-exfoliation in our rural population. I am yet to see, but then this was another interesting thing. Coming to sleep and glaucoma, IOP does elevate in the supine position, but then face down sleeping causes a significant IOP raise, and maybe in your patients where you can't find any other cause, this is something that you want to ask them and ask them not to do, face down sleeping. Obstructive sleep apnea increase the risk of developing and worsening of glaucoma, so that is one thing you should look for. And another thing that most papers tell is that we think about this alternates and lifestyle modifications only in advanced glaucoma, once the patient has 0.99 cupping and has only a central island. But the timeline should be probably in the earlier stages of the disease. So things like aerobic exercise and avoiding certain yoga positions should be practiced from the early stage of the glaucoma and for younger patients, and that may give us more results than trying it on the end stage glaucomas. Coming in brief to systemic comorbidities, hypertension, there is no evidence of any direct association, but patients with hypertension tend to have impaired autoregulation, and hypotensive episodes may happen due to antihypertensive, and nocturnal hypotension can be a factor. But how you treat it I mean, this you need to coordinate with your physician. It's very hard to treat nocturnal hypotension. Just like low IOP is very difficult to treat, low BP is also extremely difficult to address. And this recent paper by the European Eye Epidemiology Consortium showed an association, harmful association, between calcium channel blockers and glaucoma prevalence. So, earlier when we were students, we were taught that calcium channel blockers were neuroprotective. But then the newer evidence shows that there is a harmful association. So keep that in mind. Maybe if the patient is on calcium channel blockers, he can be changed to a different antihypertensive. And patients who are on systemic beta blockers tend to have lower IOPs. That is, of course, well known. Coming to dyslipidemia and glaucoma, there is a positive association between hypercholesterolemia and primary open angle glaucoma, and statin use long term has a protective effect. So people who are on long term statins as prevention,